Hello and welcome to this special episode on equitable insurance coverage for robotic joint replacement amid India's arthritis burden. Now, arthritis is one of India's fastest growing health burdens, affecting over 60 million people. Yet, only less than 10% of patients receive joint replacement surgery, leaving about the 90% of them untreated. And for many, joint replacement is the only path back to mobility and independence. Yet, while robotic technology has revolutionized outcomes with greater precision and faster recovery, limited insurance coverage remains a barrier to equitable access. Now today, we bring together experts who are driving this change. Allow me to introduce them. First up, we have Aman Gupta, Asia Representative, Partnership to Fight Chronic Disease, PFCD. We have with us Professor Dr. Pradeep B. Bhosale. He's Principal Director, Robotic Joint Replacement, Hip and Knee Surgery, Nanavati Max Hospital. We have Dr. Milind Patil, Orthopedic Surgeon, Revival Bone and Joint Hospital. And finally, we have Dr. Mudit Khanna. He's Consultant Joint Replacement Surgeon with Wokhart Hospital. Gentlemen, let's begin our discussion. First up, Aman, I'd like to start with you. I want to know why and how are you so passionate about what we are here to talk about, which is, arthritis burden in India and the need, more importantly, for insurance coverage for the same.
First of all, thanks, Sumit. Thanks for having me here. And as you rightly said, PFCD as a global organization, we are not-for-profit and we work across the world to ensure that patients and the people get access to the latest innovations. Our mission really is to ensure that no patient is kind of left behind and they have access to innovations and advanced treatments like robotic joint replacements, which are there. Let us start to look at it. What is the reason why we are so passionately talking about this particular issue? One is the overarching burden of disease. We have close to, I would say, 60 million people who are suffering. However, the access to the treatment, I'm not talking about advanced treatment, is only with the 10% of the people. So from our perspective, we need to look at from two parts. One, empowering patients with the information that when you have a problem, you need to go and talk to the experts the way we have here in our panel here. But also when you're going, find the right treatment, sure that you get the right advanced treatment, because the technology has really leapfrogged in the last 15 to 20 years. And therefore, their ability to get that treatment, get that technology will really change the way they look at the life, the quality of life kind of changes. When you have a mission like that, you do get committed to it, you get really emotionally attached to such a kind of a topic. And besides that, if you look at the fact which you talk about insurance, this whole thing is at the kind of a intersection of three things. You have a chronic disease at one side. You have patient equity and equitable access to that side of it. And third is the whole healthcare financing. How do you ensure that people get this kind of thing without thinking about the funding part of it? And such complex topics needs organizations like PFCD who can bring different stakeholders together, from policymakers to medical experts to patient organizations to health economists and so on and so forth. So that's really is why we are really at the forefront of taking this conversation forward.
Dr. Khanna, I'll come to you on this point because when patients come, they are obviously wanting to know a little bit about, in fact, they want to know a lot about robotic joint replacement. So what is that? How does it improve surgical precision, improve the patient outcomes compared to conventional methods? If you could shed some light on that.
Yeah, sure. So I think there's a lot of misconception about what robotic knee replacement or hip replacement surgery actually is. Now, I think it's important for me to explain first what it is not rather than explaining what it is. So a robotic joint replacement does not mean that the robot comes in, performs the surgery, and we are all done. It does not mean that I can work from home, like probably a lot of other people can. Robotic joint replacement surgery is a tool for A, planning the procedure, and B, executing the procedure based on the plan that you have prepared. Now, what we always say is that we've been doing joint replacement surgery for the last 30 years, every joint the same way, but every joint is not the same. Your anatomy and my anatomy are different. Until today, or until more recently, when we've actually caught up with robotics, we were doing one-size-fits-all kind of an approach. Now we have a tool that can assess a patient's individual anatomy allows us to plan before even touching the patient to place the components in an orientation that matches exactly to the patient's anatomy. And then now we also have a tool that can help us execute it. So it's phenomenal to see how technology has advanced to be able to reproduce the patient's native anatomy back and give him a joint that recovers faster, functions better, reduces the chances of complication, adds safety, and adds longevity, adds years to the lives.
Dr. Bhosale, I want to bring you in on this point, because how does this personalize the surgery? How do the surgeon and the robot work together, like what Dr. Khanna was speaking about? Because, this robotic assistance, how can it optimize eventually the surgical precision, the patient recovery, all of these points?
Yeah, it's very important that many times we take X-ray, but X-ray gives only two-dimensional view, and CT is the best mode to give a three-dimensional view, and robo, what it needs is a information. And if you give a accurate information to robo will do perfect job, absolute perfect fitting of the joint, so that the long-term result will be excellent. Longevity will increase. So perfection, that's the most important. And the best part in the world, show information to robo, is a CT. And so robo knows everything before he does any planning and execution of the surgery planning. So that's very important. So CT, even one individual, left side and right side, there can be anatomical variation. And that's very important. You cannot presume that both are same. So there are variations, and CT is an accurate guide to tell robo what exactly is the picture. Three-dimensional view.
Dr. Patil, just if you could just simplify this for our viewers, maybe what are some of the main differences between maybe the differences in patient recovery, more specifically in the robotic joint replacement compared to conventional surgery? If you could just guide us, shed more light on that.
See, what happens in a conventional surgery, there are certain steps that we are forced to take, like the medullary canal reaming, the perforation of the bone. Those things are not required in robotic surgery. So definitely it makes it much safer for the patient. So physiological recovery of the patient is much better when we have less number of steps required. Secondly, robotic surgery has a predictive role. Means we actually perform a virtual surgery before doing actual surgery. So the effect of every step that we take is known before taking. Not exactly in a conventional operation, if we take a step and afterwards we don't like it, but we already committed to it. That doesn't happen in a robotic surgery. The thirdly, in any operation, we are juggling with various variables, like multiple balls we are juggling with. So the effect of every step on each variable is known. So you are able to perform a perfect surgery which will fit the patient's anatomy. So his recovery is much faster. He probably has less medical complication post-surgery, and because of that he goes back to his work or his to family much faster than a conventional operation.
But Dr. Bhosale, I'll come to you from a very important question that I'm sure is in the mind of all the viewers. There are a lot of misconceptions that happen about robotic surgeries, especially when you talk about cost and more importantly when you talk about safety. Can you help clear some of those misconceptions for us?
Yeah, it's very, very important. Robo is a tool, and it's a wonderful tool. It needs a good information, and robo has no brain. You surgeon has to tell robo what exactly 1 degree, 2 degree angle. It's like a diamond cutting. So the bone cutting, so the fitting is absolutely accurate. So robo does not take a decision. It's a surgeon behind. He uses the information and takes a decision and tell robo, and robo will do accurately what surgeon tells. So that's a very important factor. So both teams are important. Robo just follows what surgeon says, and that gives a longevity, perfect fitting, immediate ambulation of the patient, and that's best in the world, So this is absolutely important. Robo is a tool, and you surgeon gives a exact instruction to robo, and robo will do 100% accurate job of fitting the joint.
Aman, now I want to talk to you about the role of insurance. Of course, really important, because insurance is being able to help patients a lot to get the right kind of treatment, like you said in your opening note. But what is the current landscape that you're seeing? What are some of the challenges and the opportunities that you're seeing here?
So, Sumit, as you rightly said, why do we all take insurance, right? The idea is that when you need the medical care, you have an ability to pay for it without thinking about the cost per se, and go for something which is the best. As we just heard from 3 of our experts here, if I need to go for anything related to arthritis, as a person, if I want to take it for my father, if I want to take it for any of my loved ones, I'd like to sort of say, yes, I want to go for robotic joint replacement. If the insurance cover I have says that this is not something you can get done, now that is a problem area. So while IRDAI in 2019 mandated the insurance companies that the modern technology should be included as a part of the cover, but what we are currently seeing is that the plans which we have do not universally cover that part. You have challenges of limits or the sub-limits. So when you go in and you say, I want to get this thing because this is right clinically for me, but your insurance company says, no, this is not something which can be done, that's where the issues happen. So one, it may create an issue in terms of I may delay the treatment while it may be required right now because of the financial barrier. I may say, I can't do it right now and let me do it little later. Or second is, I might let go of the technology which I know is right for my loved ones, and I go for something which is not the right one. And therefore the problem exists on a long-term side of it. As we just heard from all our 3 experts, if I go from a conventional surgery, my lifespan of that might be about 10 to 15 years, right? And then you look at further. Whereas in this case, it could be 20 to 25 years. So you're looking at a long-term value proposition of a technology, and anything which is restricting or is creating a discrimination in any possible way is not the right kind of a healthcare insurance ecosystem which we need. So currently, what we really need is insurance companies to provide a no discrimination, saying if a person is suffering, the person should be able to get the right technology as it required from the clinical part of it. It should not be a kind of a cost, should not be sort of considered as a factor per se. So I think that is one part. Also, don't penalize the patients. We have seen issues where conventional surgery, if it has an X cost and robotic has, say, a 1.1 cost, they may say, I'm going to do a robotic I'm going to give you only a 50% of the cover of that part of it. Whereas conventional will give you the whole thing. So for going for the right technology, you may get penalized. Whereas insurance idea is to incentivize that go for the right quality, go for the right technology, and ensure that your quality of life goes up.
Dr. Khanna, now the robotic joint replacement is widely available in India. So in your sense, what is the main challenge do the patients face? Is it accessibility? Is it affordability? And your thoughts on how insurance, sub-limits or caps, how do they influence the choice that patients make for their overall healthcare outcomes?
Thanks for the question. So, to be honest, this is one of the discussions we have with every patient on a daily basis. So I think telling someone that you need a joint replacement surgery by itself is something that takes time for them to absorb and be ready for. And once they take a decision that they want to have a joint replacement surgery, because we need to go back and look at what we are offering. We're neither offering a life-saving surgery nor a limb-saving surgery. We're offering a surgery that will improve their quality of life parameters. Now, when we're looking at offering something which will improve their quality of life, we want to be absolutely sure that we can reproduce the results and actually improve their quality of life in the best possible, perfect manner that we can. And robotic assistance enables us to do that. A conventional knee replacement by no means is a bad surgery. It's a great surgery. It gives great outcomes. But there is a percentage of dissatisfied people with it, which we are all aware of. And it is about bridging that gap. It's about getting the dissatisfaction rates as low as possible and getting more satisfaction rates. Now, in terms of accessibility and affordability, as you asked me, it is fairly widely accessible right now. And it is very affordable as well. The problem is when you say, okay, X patient comes in and you give them the choice of having it robotic versus non-robotic, and the patient says, okay, I would like to have it done robotic, then you break the news to the patient that, listen, if you do end up getting the surgery robotic, you will not even be covered for a conventional procedure. So you have to take the burden of the entire surgery on you, not just the differential. Not if the patient is happy to pay an additional cost of robotic by himself, the insurance company does not allow that as well. That's penalizing a patient to try and have access to better healthcare, which is not fair.
Dr. Patil, I'll come to you. Can you give me some insight on how does the Indian healthcare system compare globally? And also, when you talk about insurance coverage, what we're talking about for these kind of advanced procedures like robotic joint replacement, why is that important so that to help bring India to international levels?
See, there are our healthcare system insurance policies are quite fragmented. I mean, abroad, a country may have just a national service and maybe some private players. But what we have is the corporate insurances, the government schemes, uninsured people, and also sometimes people taking retail insurances. And what happens in an insurance policy, suppose if I take a policy just now, I mean, I'm not having any illness, but 10 years down the line, what I will develop, I don't know. And suppose now, 10 years before, robotic surgery was not the norm for arthritis. But 10 years down the line, when I require any replacement, if that is the best surgery available, but when I took the policy, it was not covered. So what do I do? The point is there are so many fine prints there, plus ambiguities beyond that. Like for example, say in Australia, about 42% the primary knee replacements are done robotic last year. And they are predicting in US, perhaps by 2030, about 70% will be robotic. So suppose if somebody has taken a policy today, doesn't cover robotic, but 5 years down the line, you would be in those 30% who can't get it done. So, our policies are not very clear actually, or maybe whether the policies, the patients are not getting it cleared before taking the policy. But the important thing is that if a disease requires a particular treatment, the insurance company should not dictate that you don't go for this treatment, go for this option, because A, what they are denying is not experimental, and B, it is not that hugely costly also.
Aman, one last question to you, because I know PFCD has been advocating equitable access to advanced healthcare technologies, but what are some key policy changes that you feel that you would rather recommend so that things like robotic joint replacement, they become covered, accessible, and equitable treatment for all patients, so that these issues that we're talking about, where patients having to decide whether to take or not, should not be coming up?
I think it's a pretty simple thing. As I said, IRDAI has mandated that fact that modern technology should be covered in the insurance. What is required now is the clarity on that front. As Dr. Patil said, there is a kind of an ambiguity, and sometimes the insurance companies take the cover of that ambiguity to deny the access to the latest technology. So what's really required is that every health insurance company should cover it. There should be a clarity and written language saying this is something which people have irrespective of the issue. So there should not be any discrimination which should exist. And I think this is something where the government, from a forward-looking, as we are in an era where India is sort of growing globally, we are economically growing, and economics is leading, is led from health side of it. Yeah. So the fact is that as in India, our push to ensure that advanced technologies are accessible to the people and should be incentivized instead of penalized. So the government needs to focus on ensuring that forward-looking advanced treatments are available. And second is insurance should be able to provide the right kind of an ecosystem and incentivize the people saying, go and get the right technology, because the value prop over a long period of time is much more higher. It would ensure from economics, it will ensure from quality of life, and it will ensure that we remain on path to growth.
And also, what would happen with this, if the technology is used widely in India, we can get patients from abroad coming for this technology, which will boost our economy. At the same time, it will prevent people from here going abroad for getting its surgery done under technology. So I think, you need to perhaps have the quality of healthcare in par with everywhere in the world. And if we are growing, doing that in entertainment or even in the warfare, why shouldn't we do it in the healthcare as well?
Just any key message that all the panelists have for policymakers and for insurers to, who are watching this, and just to urge them that, look at this robotic joint replacement, prioritize it, so that at the end of the day, it has to be accessible to every Indian who needs it. So, Dr. Khanna.
Yeah, I think this is a great platform to explain to everyone that arthritis is a very, very common disease, and it's more common than diabetes is. There's probably no family in the country that would be untouched by arthritis. And it would be great if we could go back and look at our own insurances and see whether when our loved ones need a knee replacement or a hip replacement surgery, are we covered for something like robotic procedures or not? Because it's probably time to go back and revisit and understand that that is becoming the standard of care, and to be denied the standard of care when we end up needing it is not fair. So, it's a message to all viewers, and it's a message to all insurance companies. Even, the insurers have their families.
Yeah.
So I think it's important that we do not ignore this. We understand that it's a standard of care. It's not as Dr. Patil said, an experimental treatment or an advanced treatment. It's increasingly becoming a tool to give better outcomes, faster recovery, and ensuring safety.
Fantastic. Dr. Bhosale, your...
So arthritic is really disabling, and I think India is leading in healthcare, and this technology is really well established all over the world, and we want this to be in India, and insurance people should follow and give the benefit to the people, and there should be good clarity in the insurance, and they should not punish them by cutting half the charges. So that's a very important thing. They should give a good benefit, clarity to all the patient to have the optimum result of joint replacement and longevity. So that's very important.
Fantastic. Aman, your take.
I think for the insurance company, it's simple that when you're defining insurance nowadays, don't look from a rear view mirror. The technology is changing every year. They need to looking more from a forward looking, saying what is the new technologies which are available, and they should get included as a standard part of it. As Dr. Khanna said, it's a standard practices which are there. So standard of care should be included from a forward looking side.
Fantastic. Dr. Patil, final word.
Thanks for having us, actually, because it's a brilliant platform to convey the message. Actually, robotic surgery is here to stay. It's there in, perhaps 46 countries and been there for more than 15 years, more than, 1.5 million surgeries done all over the world. So in such a situation, why should we not do it when it is the best treatment available? And also it's a fantastic teaching tool. So it will help the new generation of surgeons to kind of brush up their skills and give better outcome. So, we should not be sitting with the same previous phones where we dial. If you have a facility to just have a video call with someone abroad, why you want to go and book any study on the booth?
All right, on that note, thank you so much, gentlemen, for your time and for this enriching discussion. It's evident that robotic joint replacement isn't just about cutting-edge technology. It's about restoring movement, independence, and dignity to arthritis patients. Now, the challenge is to ensure equitable access through comprehensive insurance coverage so that quality care is not determined by affordability. PFCD continues to lead this dialogue, calling for inclusive, patient-centric health policies that make advanced care accessible to all. Thank you so much for joining us on this very special panel of equitable insurance coverage for robotic joint replacement amid India's arthritis burden. Stay healthy and stay informed.